Question 1. A nurse is caring for a patient admitted with acute decompensated heart failure, ADHF, experiencing dyspnea and orthopnea. Which assessment finding best indicates that the patient's condition is worsening? A. Increased urine output. B. Peripheral edema 2+. C. Crackles heard bilaterally throughout lung fields. D. Blood pressure 130/80 mmHg. Answer: C. Crackles heard bilaterally throughout lung fields. This question tests your understanding of acute decompensated heart failure, ADHF, and the key signs of worsening pulmonary congestion. The keyword worsening indicates a need to identify the most critical and progressive symptom. Bilateral crackles throughout the lung fields signify increasing fluid accumulation in the alveoli, a direct sign of worsening pulmonary edema and a critical indicator of ADHF progression. While peripheral edema is common in heart failure, widespread crackles suggest a more acute and life-threatening fluid overload affecting gas exchange. Always prioritize respiratory compromise when assessing patients with ADHF, as it directly impacts oxygenation. Question 2. A patient with severe sepsis is receiving a continuous norepinephrine infusion. The nurse notes the patient's mean arterial pressure, MAP, is 58 millimeters of mercury. What is the nurse's priority action? A. Increase the rate of the norepinephrine infusion as per protocol. B. Administer an intravenous fluid bolus. C. Place the patient in Trendelenburg position. D. Notify the healthcare provider immediately. Answer: A. Increase the rate of the norepinephrine infusion as per protocol. This question assesses your knowledge of managing septic shock and titrating vasoactive medications. The keyword priority action, combined with a MAP of 58 millimeters of mercury, which is below the target of 65 millimeters of mercury for sepsis, indicates the need for immediate intervention to improve perfusion. Norepinephrine is a potent vasopressor commonly used to increase MAP in septic shock, so increasing its rate, typically guided by a titratable protocol, is the most direct and appropriate initial nursing action to achieve the target blood pressure. While notifying the provider is important, the nurse can act independently to titrate medications within standing orders to stabilize the patient's hemodynamics first. Remember to always prioritize immediate, protocol-driven interventions to stabilize critical parameters. Question 3. A patient presents to the emergency department with sudden onset unilateral weakness, facial droop, and expressive aphasia. The nurse suspects an ischemic stroke. What is the most crucial piece of information to obtain from the patient's family? A. The patient's usual dietary habits. B. The exact time symptoms began. C. A list of all current medications. D. The patient's primary care physician's name. Answer: B. The exact time symptoms began. This question focuses on the immediate assessment of a suspected ischemic stroke, highlighting the time-sensitive nature of treatment. The keywords most crucial and ischemic stroke point to the need for rapid intervention to preserve brain tissue. Knowing the exact time of symptom onset is vital because thrombolytic therapy, e.g., TPA, for ischemic stroke has a narrow therapeutic window, typically within 3 to 5 hours from symptom onset. Without this critical information, the patient may not be eligible for this potentially life-saving treatment, directly impacting patient outcomes. Always remember, time is brain when managing stroke patients. Question 4. A nurse is preparing to care for a patient with acute respiratory distress syndrome, ARDS, who is on mechanical ventilation. Which ventilator setting is most commonly associated with lung protective strategies in ARDS? A. High tidal volumes, 10-12 ml/kg. B. Low positive end expiratory pressure, PEEP. C. Higher respiratory rates, 25-30 breaths/min. D. Low tidal volumes, 4-8 ml/kg. Answer, D. Low tidal volumes, 4-8 ml/kg. This question tests your understanding of lung protective ventilation strategies in acute respiratory distress syndrome, ARDS. The keyword lung protective strategies is critical, as ARDS involves severe lung inflammation and injury, making the lungs vulnerable to ventilator-induced damage. Using low tidal volumes, typically 4-8 ml/kg of predicted body weight, is a cornerstone of these strategies to minimize volotrauma, lung injury from overstretching, and barotrauma, injury from high pressures. This approach helps to prevent further lung damage by avoiding excessive stretching of fragile alveoli. Always recall that in ARDS, the goal is to gently support respiration while protecting the injured lungs. Question 5. A patient with diabetic ketoacidosis, DKA, has the following arterial blood gas, ABG, results, pH 7.20, PaCO 230 mm of mercury, HCO 312 milliequivalent/L. Which compensatory mechanism is the body exhibiting? A. Renal compensation by retaining bicarbonate. B. Respiratory compensation by increasing carbon dioxide excretion. C. Metabolic compensation by increasing acid production. D. Respiratory compensation by decreasing respiratory rate. Answer, B. Respiratory compensation by increasing carbon dioxide excretion. This question assesses your understanding of acid-base balance and compensatory mechanisms, specifically in the context of diabetic ketoacidosis, DKA. The ABG results show a low pH, acidosis, and a low HCO3, metabolic component, which is characteristic of DKA. The PaCO2 is also low, indicating that the body is attempting to compensate for the metabolic acidosis by hyperventilating and blowing off CO2, thereby increasing carbon dioxide excretion. This compensatory mechanism, known as Kussmaul respirations, aims to raise the pH back to normal by reducing the acid component in the blood. When analyzing ABGs, first determine the primary disorder, then look for the body's attempt to normalize the pH. Question 6. A nurse is evaluating a patient's arterial line waveform. The nurse observes a dampened waveform. Which intervention should the nurse perform first? A. Administer a fluid bolus. B. Check the transducer for proper leveling. C. Recalibrate the arterial line. D. Zero the arterial line system. Answer, B. Check the transducer for proper leveling. This question tests your knowledge of troubleshooting arterial line waveforms, a common skill in progressive care. A dampened waveform suggests a problem with the system's ability to accurately transmit pressure readings. The most common and easily corrected cause of a dampened waveform is an improperly leveled transducer. Ensuring the transducer is at the phlebostatic axis, fourth intercostal space, midaxillary line, is crucial for accurate readings and should be the first step in troubleshooting, as it directly impacts hydrostatic pressure and waveform fidelity. Proper leveling ensures the transducer is at the same level as the patient's heart, which is essential for accurate pressure measurements. Question 7. A patient with an acute ST elevation myocardial infarction, STEMI, has just undergone successful percutaneous coronary intervention, PCI. Which post-procedure finding requires immediate intervention by the nurse? A. Blood pressure 110/70 mmHg. B. Pedal pulses 2+ bilaterally in the affected leg. C. Sudden onset of sharp, severe back pain. D. Small hematoma at the access site. Answer C. Sudden onset of sharp, severe back pain. This question focuses on critical post-procedure complications following percutaneous coronary intervention, PCI. The keyword immediate intervention indicates a life-threatening or rapidly deteriorating condition. Sudden, severe back pain after ephemeral access PCI can be a classic symptom of retroperitoneal hemorrhage, a serious and potentially fatal complication where blood leaks into the abdominal cavity. This is a medical emergency requiring rapid assessment and intervention, as it can lead to hypovolemic shock. While a small hematoma is common, and stable blood pressure and good pulses are positive findings, severe back pain mandates immediate investigation. Question 8. A nurse is caring for a patient admitted with a severe asthma exacerbation. Which assessment finding is most concerning and indicates impending respiratory failure? A. Patient reporting mild dyspnea with exertion. B. Inspiratory and expiratory wheezing throughout lung fields. C. Paradoxical breathing with absent breath sounds. D. Peak expiratory flow, PEF. 70% of personal best. Answer C. Paradoxical breathing with absent breath sounds. This question challenges you to identify critical signs of impending respiratory failure in a patient with a severe asthma exacerbation. The keywords most concerning and impending respiratory failure highlight the need to recognize a dire clinical sign. Paradoxical breathing, where the abdomen moves inward on inspiration and outward on expiration, coupled with absent breath sounds, signifies extreme airway obstruction, severe air trapping, and respiratory muscle fatigue, indicating that the patient is no longer moving air effectively. This is a late and ominous sign, far more critical than wheezing or mild dyspnea, and demands immediate, aggressive intervention. Always remember that absent breath sounds in an asthmatic patient are a medical emergency. Question 9. A patient is admitted with a new diagnosis of myasthenia gravis, MG, and is experiencing increasing muscle weakness, dyspnea, and difficulty swallowing. The physician orders a tensilin, edrophonium, test. What is the primary purpose of this test? A. To assess the patient's neurological response to pain. B. To differentiate between a myasthenic crisis and a cholinergic crisis. C. To determine the severity of muscle weakness. D. To evaluate the effectiveness of current MG medications. Answer B. To differentiate between a myasthenic crisis and a cholinergic crisis. This question tests your knowledge of diagnostic procedures for myasthenia gravis, MG, specifically the tensilin, edrophonium, test. The keyword primary purpose directs you to the core utility of this rapid-acting anticholinesterase inhibitor. The tensilin test is used to quickly distinguish between a myasthenic crisis, which is an exacerbation of MG symptoms due to insufficient acetylcholine, and a cholinergic crisis, which is caused by excessive acetylcholine from overmedication. If muscle weakness improves after tensilin administration, it indicates a myasthenic crisis. If it worsens, it suggests a cholinergic crisis. This distinction is crucial because treatment for each crisis is vastly different. Question 10. A nurse is monitoring a patient with a full-thickness burn injury covering 40% of the total body surface area, TBSA. Which assessment finding in the first 24 hours post-burn is the most significant indicator of effective fluid resuscitation? A. Urine output of 10 milliliters per hour. B. Heart rate 115 beats/minute. C. Mean arterial pressure, MAP. 65 millimeters of mercury. D. Urine output of 0.5-1 ml/kg/hour. Answer D. Urine output of 0.5-1 ml/kg/hour. This question focuses on critical fluid resuscitation parameters for severe burn injuries. The keyword most significant indicator of effective fluid resuscitation points to the primary goal of fluid therapy in burn patients, which is to maintain organ perfusion. In the initial hours following a major burn, a reliable measure of adequate end organ perfusion, particularly renal perfusion, is urine output. Maintaining a urine output of 0.5-1 ml/kg/hour, or 30 to 50 ml/hour for adults, indicates that the kidneys are being adequately perfused, preventing acute kidney injury and reflecting overall successful fluid replacement. While MAP is important, urine output specifically reflects kidney perfusion in this context. Question 11. A patient with severe acute pancreatitis is admitted to the progressive care unit. The nurse assesses the patient and expects to find which laboratory abnormality? A. Hyperglycemia. B. Hypokalemia. C. Hypercalcemia. D. Elevated albumin. Answer: A. Hyperglycemia. This question assesses your knowledge of the common laboratory abnormalities seen in acute pancreatitis. Acute pancreatitis involves inflammation of the pancreas, which can impair its endocrine function, specifically insulin production. This impairment often leads to transient or persistent hyperglycemia, as the damaged pancreatic beta cells are unable to secrete sufficient insulin to manage glucose levels. Other common findings include elevated amylase and lipase, and sometimes hypocalcemia, but hyperglycemia is a frequent and important metabolic derangement. Always anticipate glucose dysregulation when caring for patients with acute pancreatitis. Question 12. A nurse is caring for a patient with a new order for continuous renal replacement therapy, CRRT. What is the primary advantage of CRRT over intermittent hemodialysis for a critically ill patient? A. Faster removal of toxins and fluid. B. Requires less specialized equipment. C. Better hemodynamic stability. D. Allows for greater patient mobility. Answer: C. Better hemodynamic stability. This question tests your understanding of continuous renal replacement therapy, CRRT, and its benefits, especially in critically ill patients. The keyword primary advantage highlights the most significant benefit for this vulnerable population. CRRT involves a slow and continuous removal of fluid and solutes, minimizing the rapid fluid shifts and electrolyte imbalances that can occur with intermittent hemodialysis. This gentle, continuous process helps to maintain hemodynamic stability, which is crucial for patients who are often hypotensive or experiencing shock. This stability reduces the risk of further organ hypoperfusion and cardiac complications. Question 13. A patient with a traumatic brain injury, TBI, has an intracranial pressure, ICP, monitor in place. The nurse notes an ICP of 22 millimeters of mercury. Which intervention should the nurse implement first? A. Administer a sedating medication. B. Elevate the head of the bed to 30 degrees. C. Prepare for cerebrospinal fluid, CSF, drainage. D. Increase the patient's intravenous fluid rate. Answer: B. Elevate the head of the bed to 30 degrees. This question focuses on immediate nursing interventions for elevated intracranial pressure, ICP, in a patient with traumatic brain injury. The keywords ICP of 22 millimeters of mercury, which is above the normal 5 to 15 millimeters of mercury, and first indicate the need for a rapid and standard intervention. Elevating the head of the bed to 30 degrees promotes venous drainage from the head, which helps to decrease intracranial volume and, consequently, ICP. This is a non-pharmacological, evidence-based, and readily available intervention that should be performed promptly. While other options might be considered, positioning is a foundational and immediate step to manage elevated ICP. Question 14. A nurse is reviewing the medication list for a patient with acute coronary syndrome, ACS. Which medication is essential to administer in the pre-hospital or immediate hospital setting to inhibit platelet aggregation? A. Metoprolol. B. Aspirin. C. Lisinopril. D. Atorvastatin. Answer: B. Aspirin. This question targets your knowledge of immediate pharmacological interventions for acute coronary syndrome, ACS. The keywords essential, pre-hospital or immediate hospital setting, and inhibit platelet aggregation clearly point to the critical role of aspirin. Aspirin is an antiplatelet medication that irreversibly inhibits cyclooxygenase, preventing the formation of thromboxane A2, which is crucial for platelet aggregation. Early administration of aspirin significantly reduces mortality and recurrent ischemic events in patients experiencing ACS by preventing further clot formation in the coronary arteries. It's a foundational therapy for anyone suspected of having a heart attack. Question 15. A patient with a history of hypertension and diabetes is admitted with hyperosmolar hyperglycemic state, HHS. The nurse anticipates which primary fluid resuscitation fluid will be ordered initially. A. Dextrose 5% in water, D5W. B. 0.45% sodium chloride, half normal saline. C. 0.9% sodium chloride, normal saline. D. Lactated Ringer's solution. Answer: C. 0.9% sodium chloride, normal saline. This question assesses your understanding of initial fluid management in hyperosmolar hyperglycemic state, HHS. The keyword primary fluid resuscitation and the condition HHS, characterized by severe dehydration and hyperosmolarity, are crucial. Normal saline, 0.9% sodium chloride, is the initial fluid of choice because it rapidly expands the intravascular volume and helps to restore renal perfusion without causing rapid shifts in intracellular fluid, which can exacerbate cerebral edema in a severely hyperosmolar state. Aggressive rehydration with isotonic saline is vital to correct hypovolemia and improve tissue perfusion. Question 16. A nurse is monitoring a patient on mechanical ventilation. The high-pressure alarm frequently sounds. Which potential cause should the nurse investigate first? A. Patient is becoming hypotensive. B. There is a leak in the ventilator circuit. C. Patient is coughing or biting the endotracheal tube. D. Patient requires increased sedation. Answer: C. Patient is coughing or biting the endotracheal tube. This question tests your troubleshooting skills for ventilator alarms, a common PCCN scenario. The high-pressure alarm indicates increased resistance to airflow into the patient's lungs. The keyword first suggests identifying the most common and easily correctable cause. Patient-related issues like coughing, gagging, or biting the endotracheal tube frequently trigger high-pressure alarms and are often the first thing to assess. After checking for patient causes, the nurse would then investigate kinks in the tubing, mucus plugs, or pneumothorax. Always address the most common and immediate patient-related causes before moving to other potential issues. Question 17. A patient is admitted with a pulmonary embolism, PE, and is receiving a continuous heparin infusion. The nurse should monitor which laboratory value to assess the therapeutic effect of heparin? A. Prothrombin time, PT. B. International Normalized Ratio, INR. C. Activated partial thromboplastin time, APTT. D. Platelet count. Answer C. Activated partial thromboplastin time, APTT. This question focuses on monitoring anticoagulant therapy, specifically continuous heparin infusion for pulmonary embolism. The keywords therapeutic effect and heparin are key to identifying the correct laboratory test. The activated partial thromboplastin time, APTT, is the standard and most commonly used laboratory test to monitor the therapeutic efficacy of unfractionated heparin. The goal is to maintain the APTT within a specific therapeutic range, typically 1.5 to 2.5 times the control value, to prevent further clot formation while minimizing the risk of bleeding. Remember, PT and INR are used for warfarin, not heparin. Question 18. A patient is experiencing severe chest pain and ST segment elevation in leads 2, 3, and AVF on the electrocardiogram, ECG. The nurse recognizes this as an inferior wall myocardial infarction. Which complication is the patient at highest risk for developing? A. Ventricular tachycardia. B. Right ventricular infarction with bradycardia. C. Pulmonary edema. D. Left bundle branch block. Answer B. Right ventricular infarction with bradycardia. This question tests your ability to correlate ECG findings with potential complications of specific myocardial infarction, MI, locations. ST segment elevation in leads 2, 3, and AVF indicates an inferior wall MI, which is often caused by occlusion of the right coronary artery, RCA. The RCA typically supplies the inferior wall of the left ventricle and, crucially, the right ventricle and the sinoatrial, SA, node. Therefore, an inferior MI puts the patient at high risk for right ventricular infarction, leading to right-sided heart failure symptoms, and bradycardia or atrioventricular, AV, blocks due to SA node dysfunction. Understanding coronary artery anatomy and its supply is critical for anticipating MI complications. Question 19. A nurse is caring for a patient experiencing an anaphylactic reaction. After ensuring airway patency, what is the priority medication to administer? A. Diphenhydramine. B. Epinephrine. C. Famotidine. D. Albuterol. Answer B. Epinephrine. This question assesses your knowledge of emergency management for anaphylaxis, a critical skill in progressive care. After securing the airway, priority medication for an anaphylactic reaction is epinephrine. Epinephrine is a potent vasoconstrictor and bronchodilator that rapidly reverses the physiological effects of anaphylaxis by increasing blood pressure, reducing airway edema, and causing bronchodilation. It acts quickly to counteract systemic vasodilation and bronchospasm, making it the cornerstone of immediate treatment. Always administer epinephrine first in an anaphylactic emergency before other supportive medications. Question 20. A patient in the progressive care unit suddenly becomes unresponsive and pulseless. The nurse initiates a code blue. What is the immediate priority action after calling for help and assessing the patient? A. Obtain an automated external defibrillator, AED. B. Administer 1 mg 4-push epinephrine. C. Begin high-quality chest compressions. D. Establish intravenous access. Answer C. Begin high-quality chest compressions. This question tests your knowledge of basic life support, BLS, and advanced cardiac life support, ACLS, protocols for cardiac arrest. The keyword immediate priority action after assessing unresponsiveness and pulselessness directs you to the most critical first step in resuscitation. High-quality chest compressions are the cornerstone of cardiac arrest management because they provide vital blood flow to the brain and heart, improving the chances of survival. Compressions should be initiated immediately while other team members retrieve the defibrillator and establish for access. Push hard, push fast, allow full chest recoil is the mantra to remember. Question 21. A nurse is caring for a patient with sepsis who has a central venous pressure, CVP, of 2 mm of mercury and a mean arterial pressure, MAP, of 60 mm of mercury despite initial fluid resuscitation. The healthcare provider orders initiation of a vasopressor. What is the primary goal of vasopressor therapy in this patient? A. To decrease systemic vascular resistance. B. To reduce cardiac output. C. To increase central venous pressure. D. To achieve a target mean arterial pressure, MAP, typically greater than 65 mm of mercury. Answer, D. To achieve a target mean arterial pressure, MAP, typically greater than 65 mm of mercury. This question assesses your understanding of vasopressor therapy in the context of septic shock. The patient's low CVP and MAP indicate persistent hypoperfusion despite initial fluids, necessitating vasopressor support. The primary goal of vasopressors in sepsis is to increase systemic vascular resistance and, consequently, raise the MAP to a level that ensures adequate organ perfusion, typically targeting a MAP of at least 65 mm of mercury. This improved perfusion helps to reverse tissue hypoxia and prevent organ dysfunction. Vasopressors aim to restore vascular tone and improve blood pressure, not to decrease resistance or CVP. Question 22. A patient with cirrhosis develops hepatic encephalopathy. The nurse assesses the patient for hysterexis. How does the nurse best assess for this finding? A. Ask the patient to extend their arms with wrists hyperextended and fingers spread. B. Have the patient close their eyes and touch their nose with alternating index fingers. C. Observe the patient's gait for unsteadiness or ataxia. D. Ask the patient to repetitively tap their foot. Answer. A. Ask the patient to extend their arms with wrists hyperextended and fingers spread. This question tests your clinical assessment skills for hepatic encephalopathy, specifically identifying hysterexis. Hysterexis, also known as a liver flap, is an involuntary flapping tremor, particularly of the hands, that is a classic sign of severe metabolic encephalopathy, often seen in hepatic failure. To assess for hysterexis, the nurse instructs the patient to extend their arms with their wrists dorsiflexed, hyperextended, and fingers spread apart. If hysterexis is present, there will be an irregular, rapid, brief flexion-extension movement of the fingers and wrist. This specific maneuver helps elicit the tremor, which is crucial for diagnosis. Question 23. A nurse is preparing to administer an intravenous push medication to a patient with a peripheral 4. What is the most important initial nursing action to ensure medication safety? A. Check for patient allergies. B. Assess the foresight for patency and signs of infiltration. C. Verify the medication dose with another nurse. D. Flush the 4 line with normal saline. Answer, B. Assess the foresight for patency and signs of infiltration. This question focuses on medication safety, particularly when administering intravenous push medications. The keyword most important initial nursing action directs you to the foundational safety steps specific to 4 administration. Before pushing any medication, it is absolutely essential to assess the foresight for patency, ensuring it's functional, and signs of infiltration or phlebitis. Administering a medication into an infiltrated or compromised foresight can cause tissue damage, pain, and prevent the drug from reaching the systemic circulation. While allergy checks and dose verification are critical, foresight assessment directly impacts the safe delivery of the medication. Question 24. A nurse is reviewing a patient's arterial blood gas, ABG, results, pH 7:30, PaCO 255 mm of mercury, HCO 326 milliequivalent/L. The nurse interprets these results as A. Metabolic acidosis, uncompensated. B. Respiratory acidosis, partially compensated. C. Metabolic alkalosis, uncompensated. D. Respiratory acidosis, uncompensated. Answer D. Respiratory acidosis, uncompensated. This question assesses your ability to interpret arterial blood gas, ABG, results, a fundamental skill in progressive care. Analyzing the values, the pH of 7:30 is acidic, the PaCO 2 of 55 mm of mercury is high, indicating a respiratory acidotic component, and the HCO 3 of 26 milliequivalent/L is within the normal range. Since the pH is acidic, the primary problem is acidosis. The high PaCO 2 matches a respiratory origin. Because the HCO 3, the metabolic component, is still normal, the kidneys have not yet had time to compensate, making it an uncompensated respiratory acidosis. Always start by evaluating the pH, then compare PaCO 2 and HCO 3 to their normal ranges. Question 25. A patient is on a continuous infusion of nicardipine for severe hypertension. The nurse notices the patient's blood pressure is 88/50 mmHg. What is the nurse's priority action? A. Increase the nicardipine infusion rate. B. Administer a fluid bolus. C. Decrease or stop the nicardipine infusion. D. Notify the healthcare provider. Answer C. Decrease or stop the nicardipine infusion. This question tests your ability to manage intravenous antihypertensive medications and respond to signs of overmedication. The keyword priority action, combined with the patient's significantly low blood pressure, 88/50 mmHg, while on nicardipine, a potent vasodilator, indicates a need to immediately reverse the drug's effect. The most direct and appropriate action is to decrease or stop the nicardipine infusion, as continuing it would further exacerbate the hypotension and risk organ hypoperfusion. While notifying the provider is important, the nurse must act first to prevent patient harm by adjusting or discontinuing the medication. Always prioritize immediately correcting the cause of the adverse effect when it's directly attributable to a titratable medication.